challenged by the task to deliver exceptional, personalized care at a lower cost. Despite spending nearly 1/5 of our gross domestic product on healthcare, we struggle to meet this goal. Financial pressures on care providers are increasing. This isn't sustainable. So how can we deliver high-quality, personalized care that patients deserve, given the cost pressures we face? At Dartmouth-Hitchcock, we've created ImagineCare, a new cloud-based solution built on Cortana Intelligence and Dynamics CRM that enables providers to help patients achieve better health. With the help of Microsoft, Dartmouth-Hitchcock is building a technology platform to serve healthcare organizations and patients across the country, setting a new standard for personalized care. Now, using machine intelligence, providers can develop a care plan that's unique to each patient. We can monitor patients from their homes, where data is collected from devices and sent to the cloud, to ImagineCare's 24/7 contact center, where registered nurses continually monitor a patient's health status and potentially serious trends.
Cortana, summarize health stats for Ben Andrews.
Ben Andrews' weight has increased more than 2 pounds in the last 24 hours. Please review the home dialysis protocol prescribed by Dr. Phillips.
Patients get reminders and encouragement and dynamic updates to their care plans, improving their health, helping them avoid unnecessary trips to the emergency room, and reducing the cost of care. With support from loved ones and real-time interventions, there is less likelihood of readmission. With Cortana Intelligence and Dynamics, we're transforming the way healthcare is delivered today, improving patient outcomes, reducing costs, and offering an unprecedented level of personalized care.
The objective really was, to show what, and is not to show a future vision. This is something that is already happening, for good or bad. This is an example from the US, but it is starting, to happen in India as well. And we would soon see home care, geriatric care, and all of that, having a big role and play. And you saw, multiple devices in terms of home care devices, wearables, all of that come together in a smart and intelligent manner, and then, coupled with technologies for, machine learning and advanced analytics, start to make healthcare that much more effective. Now, most of, when we talk about, medical devices, and when we talk about, having a guidance and a policy around that, the usual conversations would veer towards interoperability, and it is important that that as a subject gets discussed. But then in terms of once there is standardization of communication protocols, for example, some of these problems will get addressed. There is also the sense of energy management, saying that a device connected to internet is going to consume energy more. So there is going to be a need for energy harvesting, and technologies would need to improve in that direction. But that is also happening as well. The key important aspect that I would want to focus on is in terms of cybersecurity, when it is going to, when we're talking about devices that are going to be connected, to the internet. And this is something that needs to be, given a fair bit of focus and attention. And quickly, in terms of the reasons for having to do that. The most important reason for having to do that when we're talking about Internet of Medical Things is that we're essentially trying to get two worlds together. We had what was the IT world, which is all about our laptops and servers and PCs and all of that is one world, and then we have the operation technology, the OT world. And what IoT is really doing is trying to bring those two together. And if you see, the focus of these two worlds are very different. The IT world understands security. The OT world is largely safety focused. So there is going to be a lot of mismatch when these two worlds are going to be brought together. The physical and the digital world are going to be brought together by IoT. And that is the reason why some of the things that we talk from a cybersecurity standpoint will have to extend towards, when we're talking about interoperability and when we're talking about, a guidance in the area of medical equipment and devices. Also, adding to the complexity is the fact that there are different players that are going to be involved in something like this. There is going to be a lot more people than the device manufacturers themselves. There is going to be somebody who is going to take an IoT device and build an application around it. There is going to be a provider who is going to be coming into play as well. There is going to for delivering healthcare services. There is going to also be a cloud services provider who is going to come into play. So when we think about cyber security, when we think about IoT, it needs to be a lot more comprehensive than looking at security from a device's perspective. It needs to look at device security, it needs to look at connection security, and it also needs to look at cloud security. And this is one of the ways in which at Microsoft we are approaching security around IoT. And the limited points that I had wanted to make as a part of this dialogue was one, when we are talking about evolving standards around medical devices, it's also important to look at cyber security around IoT as to look at IoT itself and have a view on IoT. Secondly, to also look at cyber security in a big way under that, and my submission to Dr. Gupta as well as members from the government would be that we would be very keen to talk in depth in terms of how we are approaching this and share our experiences. Thank you.